Hey guys, Clint here to talk to you about the joint capsule. Okay, so we're in this case the hip. For my hip to flex like this, the head of the femur has to go back and down. Okay, we have to have that posterior and inferior glide. Okay, for me to rotate laterally, and you can feel this, for me to do this lateral rotation, put your hands on the sacrum, my sacrum comes forward. For me to internally rotate, my sacrum comes back. That's what's happening to that whole sacral hip joint complex. Okay? When we externally rotate, everything locks forward into place. When we internally rotate, it comes back. There has to be adequate room here for that to occur. Okay? This can be a difficult thing to address on your own without bands or without any kind of equipment. So I'm going to show you how you can address that without anything. Okay? Go without how you can kind of do this manual therapy on yourself. So you're going to get a knee. So we're going to stretch our left side. We're going to get here, cross over like this. Okay. The more of an angle you get here, it just winds it up a little more aggressively, and then you're going to lean forward. Okay. You can put your hands on the floor if you need to. Okay. And what's happening is I'm just going to kind of move, usually kind of to the side and back. I should feel a little pinch up here in my hip. Okay? What I'm trying to do is push that femur, using that head of the femur to push it into the back of the socket and stretch out that joint capsule. You're going to need to hold this for 2+ minutes to get a good stretch out of it. Okay? Give that a shot. Hold it here. I'm not going to hold it for that long just for demonstration purposes. I feel a little pinch. Now, I'm going to stand up. Okay? You're going to see me squat. You can see how much farther my left leg comes out. Alright? Step back to get a little better angle. Left knee comes farther out that way. Okay? That's what we want. We have more rotation in there because we have more room in that capsule. Okay? When we address that joint capsule and we have adequate space here in the joint, that changes the length-tension relationship from where the muscle originates and where it inserts. Okay? I didn't do this beforehand, but you guys try to touch your toes, then do that stretch, and then try to touch your toes again. By addressing that joint capsule, a lot of times just that on its own will cause the hamstrings to let go. Alright guys, give that a shot. Let me know how it goes.